Okay, let's start. Good afternoon to everyone on the fourth day of European Public Health Week. First of all, I want to thank to Society of Public Health Thinking and Innovation as the organizer of this session. And also I want to thank you to Istanbul Medipol University and to the European Public Health Association for their contributions. Now, let me introduce today's speaker, Dr. Sabanur Çavdar, to you. She is a public health specialist from Turkey. She has experience in managing public health and primary healthcare services at local Ministry of Health levels in Istanbul. Dr. Sabanur Çavdar earned her Doctor of Medicine from Gazi University and completed specialty in public health at Istanbul University Cerrahpaşa Medical Faculty. She is a Fulbright Humphrey Program alumna of Emory University, and she is pursuing a PhD in health management at Üsküdar University, focusing on evidence-based public health management. Public health research. And we also had a chance to work together in Istanbul Medipol University as faculty members. Now she works at Istanbul Eyüp Sultan District Health Directorate, and today's speech title is Universal Health Coverage Progress and Challenges in an Aging World. We are wondering your speech, Dr. Sabanur Çavdar, and the floor is yours.
Thank you so much. And thank you for your kind words as well. And it's great to be with you this afternoon. And thank you for joining us. So at this session, we will be talking about universal health coverage. And when I was thinking about the topic, I was aiming to share the universal health coverage indicators and the measures and the arguments about universal health coverage. I want to share these arguments with you, and at the same time, I want to update my knowledge while I'm contributing to yours. So think this as a training in both ways, or a discussion both ways. So please feel free to ask me and make contributions at the end of the session. So I'm sure that you are familiar with the concept, but I will remind you the definition of universal health coverage. It means that all people deserve qualified health services whenever they want, they need, or wherever they need, without facing any kind of financial hardship. So that's the definition. That's the main definition, and it covers essential health services, and that means all the categories of healthcare services, like promotive healthcare services, preventive services, treatments, curative services, rehabilitation, and palliative care services as well. And when we think about these all kind of services and very comprehensive approach, you will remember the concept of primary healthcare. And these images, I love these images. They summarize the topic very well, and they covers many aspects of primary healthcare and universal health coverage. And these are from the Astana Declaration and the documents of after Astana Declaration from WHO. And on the left side, on this around the primary healthcare house, you will see the primary healthcare covers all the services from birth to the last days of life, before birth to the death. And it covers, like I said, promotion, prevention, curative, rehabilitative and palliative services. And it covers all the essential services, as you know, the majority of the needs of the people and the population. So it's very compatible with the universal health coverage. And it's said that primary healthcare is a critical foundation for universal health coverage. So this is the interaction with primary healthcare and universal health coverage. They support each other. They are compatible. They explain the situation together. And as you know, there's an interaction with SDGs. That we explain these interactions, like if you support primary healthcare, if you have if the system, the healthcare system has the perspective of primary healthcare, and if the healthcare system is strong in terms of universal health coverage, it will be we will see the impacts on sustainable development goals. And it's known that the strength of the healthcare system doesn't affect just the Sustainable Development Goal 3, the good health and well-being goal. It also affects many other goals, many other targets as well. And it's shown that these goals, the Sustainable Development Goals, work in different ways. And when there's an improvement of health, it will affect others. And as we know from the social determinants of health aspect, if there's an improvement of other development goals, it will result with good health and well-being. And these are the 10 targets of Sustainable Development Goal 3. And the 8th one here it's directly called to achieve universal health coverage. So it's written in the SDGs. And I mentioned about the strengthening the health systems, and it works that way. When the health system is more strength, it helps the target 3, so it helps to achieve all people and communities to have qualified, timely, comprehensive health services when they need, where they need, and when and while they're receiving these health services, they won't face any financial hardships. If your health system is strength, that's an outcome, or that's how it works. And like I mentioned, it's very connected. It's very connected with the determinants of health as well. At the end, when there is an improvement in universal health coverage, the target 3.8, we will see improvement on other SDGs. We will see positive impacts on other SDGs too. For example, if someone doesn't face any financial hardship because of their health problem, they won't see poverty, and they will be active in economical aspect in the community. And I can give so many other examples, but I'm sure that you get the point. So when did it start? Actually, there are some measures and the discussions about universal health coverage during 2000s, and most of the measures, the indicators start at the year of 2000. I will show you in a minute. But the target 3.8, to achieve universal health coverage target, is written in the SDGs in 2015 for the first time. And then in 2019, the UN countries, they accepted the same target again. So it's in the SDGs today, so it's one of the targets for 2030 globally. And I mentioned about the financial part of this, financial protection part, but when you hear about universal health coverage, or when you talk about universal health coverage, people understand the health insurance systems, the financial protection part of the targets, or the term. But actually, it's not just the financial part. It covers the quality of the healthcare services, as well as the safety, efficacy, the effectiveness of the service with quality, safety, accessibility, and comprehensiveness of these services. It's not just healthcare services, it also covers the essential medicines and vaccines for all. So it has some other aspects too. And I believe we undermine these parts of universal health coverage. We think that it's like a general health insurance is enough to talk about universal health coverage, but it doesn't. So with this target, the SDG target 3.8, the target of achieving universal health coverage, there are two indicators basically used to measure and follow the status about these SDGs globally and for my countries. The first indicator is the coverage of essential health services. It measures the coverage of essential health services. And in order to do that, they made an index. It's called the Universal Health Coverage Service Coverage Index. And at the beginning, it has 16 indicators in 4 categories. But over time, because of the lack of data, currently we are using 14 indicators in 4 categories. And the other indicator is about the financial protection, and it's the measure related to catastrophic health spendings of people in the community. So let's look at those briefly. So this is the status of the world in terms of these 2 indicators. These are the 2 main indicators that we evaluate the status of the universal health coverage globally. Okay, so on the left side, you will see the percentage of catastrophic out-of-pocket health spendings globally. So we want it to be less. We want it to be close to the 0 out-of-pocket health spendings. We want it to be less. But as you can see over time, so we have the data from 2000 till 2019. This is the recent one. You can see that there's an increase on out-of-pocket health spendings over time, over years. And the other indicator was the service coverage index score. This is a score. It's a score between 0 to 100. And it consists of 14 indicators, like I said. So, and we want this score to be higher. If it's higher, it means that the coverage is higher for this population. It can be country, region, or in this case, it's globally. So we want it to be higher globally. And it's here for 2019. So, okay, briefly, we can say that there's an increase in coverage of healthcare services globally, that it's getting better over time. But there's a problem with out-of-pocket health spendings, expenditures, because it's increasing. The catastrophic, these are not just the out-of-pocket health expenditures, by the way, these are the catastrophic ones. Catastrophic out-of-pocket health spendings are increasing. So the aim is to go through this green arrow. And this umbrella, it wasn't on the graph originally. I put it here. This is a symbol of, the umbrella is the symbol of universal health coverage. You will see it's constantly throughout the slides. And if you're reading or searching something about universal health coverage, you will see this umbrella because it represents many things. I will explain it too. So yeah, the aim is to go to the umbrella, to have the umbrella. And yeah, I mentioned that it's not good. The catastrophic health expenditure is increasing, but the coverage is getting better. And especially this map shows the increase, the gains in service coverage globally based on countries. And when it's darker, it means that they went more far than the others. But I want to remind you that they didn't start at the same points. So if a country has lower points scores at the beginning, they have more room to improve. And if a country has a higher score of health coverage, service coverage, they have less room to improve, but as you can see, most of the countries improved. And so the world is working on the healthcare system, healthcare coverage, we can say so. And this is another way to show that, another graph showing that. So these are the system coverage index groups. The points, the scores represented, the groups of the scores represented in different colors. So at the beginning, this is before SDGs, of course, but at the beginning, there were some countries has below 20 score points, and now so for the last couple of years, it's more better, but it's not getting better. You know, there isn't much change on the service coverage globally. If you look at the years and the distribution of the groups. So it's getting better, but something has slowed and it's not improving. Before having some discussions on that, let's look at the determinants of this index. I mentioned about 4 categories and some indicators. So these categories are, the first one is reproductive, mental, maternal, newborn, and child health. Second one is infectious disease. Third one is non-communicable diseases. And fourth one is the service capacity and access. So when we are talking about coverage of essential health services, this index is just looking for these 4 topics. These are, also, of course, important topics, but it doesn't mean that we are talking about all aspects of a health system. We are talking about some selected indicators. And I mentioned about the scale is a score between 0 and 100. It's a unitless scale because it's some apples and peeps. You got my point. Because there are some, these categories, and these categories, there are some indicators, and for each of them, a score is calculated, and there's at the end, the index score is calculated with the geometric mean of these 14 trace indicators. I won't go in deep on the calculation part. I just want to mention that malaria is under infectious diseases, and it's calculated based on the risk status of the country. It depends on the risk status on the country. So if a country doesn't have malaria cases, it doesn't include it. But yeah, the others are included. And so, for instance, how do you calculate family planning? I asked this question at the beginning, you know, okay, I have the family planning services, I have the resources, I have the centers, I have the, I trained my physicians and midwives and nurses. So I as a health care system provider, you can say that, okay, we have all the family planning services for our community, for our population. But the index works, the indicator works in a different way. They don't care what you say to them, but index asks people with household surveys if the reproductive aged women satisfied the demand. So I will read it. If they have get the necessary methods, they ask them, okay, this indicator shows the percentage of women says that their demand was satisfied with the seeking of modern methods. Okay, so, and there, I won't read all the indicators, but each of them can be calculated in a way with surveys, with some estimates, and using, at the end, the data source can be the global databases. And these are the 4 indicators under the first category, the reproductive, maternal, newborn, and childhood category. So they are looking for, they're calculating family planning services, pregnancy and delivery care services. This is, you may remember that the recommended antenatal care visits number is 4. So if they're looking, what's the percentage of 4 or more antenatal care visits in this country, and it's also as household conducted by household surveys. And the other one is childhood immunization, but they don't ask for all kind of immunizations, or they don't ask, the indicator doesn't ask for all the childhood schema in your country. It just asks about the diphtheria, tetanus, and pertussis vaccine, and if the children get all 3 doses of this vaccine. And the 4th one is child treatment. It's also related to pneumonia, suspected pneumonia cases. And the second category was infectious diseases. It asks about tuberculosis treatment, HIV treatment, and malaria prevention, and water and sanitation status. And the 3rd category was non-communicable diseases. I want to mention these indicators in name because today we're talking about aging world, and non-communicable diseases is getting our major issue globally in terms of healthcare services and public health programs as well. So prevention of cardiovascular disease is the first one. It covers the hypertension treatment. Okay, so they calculate the prevalence of hypertension treatment status based on surveys. And second indicator is the management of diabetes. The 3rd one is cervical cancer screening in women, but actually because of the insufficient data, the lack of data, this is not in the calculation of the index currently, but I want to mention about it. It can be upcoming years. Okay, the countries can be evaluated by cancer screenings, cervical cancer screenings upcoming years. So this is also this is kind of important indicator because they decided to put it in the index, but they couldn't evaluate it because lack of data. But actually, so this shows us as there is a problem here, but it doesn't reflect, it's not being reflected in the index because it's not calculated. And the fourth one is the related tobacco control. Actually, this is also not asking about the programs of tobacco control. This indicator asks about the tobacco consumption of people over 15 years. Okay. And the last category is service capacity and access. Basically, they want to see what's the number of beds-based population per person, hospital beds, healthcare worker density, or the number of the healthcare professionals per person. And the last one is health security. It's related to International Health Regulations Core Capacity Index. This is also another index. But the 4th indicator that's not also included in the current index is access to essential medicines. These are there's a list of WHO recommended core list essential medicines, and this is also not calculated because lack of data. Okay, I know that this was so much indicator information, but I hope that it will be helpful to understand the concept. At the end, using these indicators, and a major indicator that the one is SDG 3.8.1 is calculated. It's called Universal Health Coverage Service Coverage Index. So it's calculated, like I said, globally and for each country. You can see the status of this is the latest data, and you can see the distribution of countries or the colors. When it's getting darker, it means it's higher. The service coverage is higher. Universal service coverage is higher. If you want to look at the based on WHO regions, you can see the highest score is in Europe, then Americas, and then Western Pacific, and the less score is in Africa region. And you can see, I just want to briefly show that it's a reverse table. So this is the most recent, this is the previous data, the oldest data. And in 2000s, most of the countries, most of the regions have lower scores, very low scores, but in time there's a progress. Yeah, we know that there's a progress, but is it continuing? We don't, we know that there are some problems on improvement of service coverage. And within the regions, you can see not every country has the same index score. So yeah, that's the average. As you know, this is the region's average. These are the region's average scores. But when you look at the countries, you will see the inequalities between countries as well. So the highest score is for Canada, then Korea, Republic of Korea, then Iceland, Singapore, and Germany, and it continues. And I'm from Turkey, so my country is here, so it's not so bad. And the number is, the recent number is, the score number is 78, 76. And when you look at the improvement over the years, we can see that in 2000 it was 15.7, and it was much more better comparing so many countries. This is a random table, by the way. I just I selected some different countries to compare them, but it was 57 in 2000. But over the years, the improvement, we saw the improvement, especially after the health system reform. We can see the quick improvement here, but then we see a plateau of the score. So it's remaining for a while. But and then when we will talk about it a bit more about here, we faced with COVID, with of course globally. And I mentioned about my country, but also we can compare these indexes, so the service coverage, healthcare service coverage, based on the income of the countries. And briefly, you can say that the problem is the major problem is low-income countries, so it's related to income. Yeah, this is the average score of globally. This scores average globally is 68. And these are the sub-indexes that we talk about. And you can see the scores based on different groups, WHO groups, World Bank income groups, or regional groups. I mentioned about the major deficiency in low-income groups in terms of service coverage index. And also the lower middle income group has some room to improve. And these are the service coverage, the healthcare service coverage is basically based on financial systems. We will talk about it in a minute. So I want to underline that we talk about the importance of non-communicable diseases indicators because of the aging world. But if you just take a step back and look at these colors, you can see that that column has a problem. And this is the non-communicable disease problem, and it's globally. Globally, we have problem of coverage of non-communicable diseases, the healthcare services related to non-communicable diseases, and it just covers 3 index. You can remember those: the blood sugar, tobacco, and what was the other one? Hypertension treatment. So these are the major risk factors and the major problems. We know that so these are important indicators, but non-communicable diseases is a huge topic, and we even didn't want to started to evaluate the other healthcare services under this topic. So in this index, we can see there's a problem here, and we start thinking on that. like yesterday. We have to start. And this is the same indexes, same sub-indexes global on the globe on the map, world map. And this is the reproductive, maternal, newborn, and child health index. And you can see the major low scores are in Africa, and it's similar for infectious diseases. And actually, the Asian region also, the Asia is also has some room to improve on infectious disease service coverage. But yes, when we talk about non-communicable diseases, it's a problem of all the globe, because this is UN data, and in 2015, it's expected to see 1.6 billion elderly people, and elderly population means more need for healthcare services. I'm not going to explain these relations, by the way. And of course, it's not just about non-communicable diseases. When people getting older, they start, their healthcare needs is getting, they're increasing also. So the service capacity and access in sub-indexes also getting important, considering these aging populations. So that was the first part of the target. This was the first indicator, service coverage index. And the second one is, like I said, it's related to catastrophic health spending. It's related to financial protection. So basically, people should face some financial barriers regarding out-of-pocket payments. Okay, maybe they have some other barriers, financial barriers. But regarding out-of-pocket payments in healthcare, it can be catastrophic out-of-pocket payments, or it can be impoverishing out-of-pocket payments. So it can be a payment that doesn't count as a catastrophic payments, but people get poorer and poorer in time because of these impoverishing payments. They are getting more vulnerable in an economical way. So it causes with financial hardship. So this indicator is focusing on this part of this financial system. And it's calculated as the proportion of the population that face catastrophic levels of out-of-pocket health spending. It can be, the threshold can be 10% or 25%. It depends on the calculation way. And also there are some other indicators showing the absolute or relative poverty line based on out-of-pocket payments, based on poverty lines, or etc. So these are supplementary indicators, but firstly, you can remember this financial protection part of universal health coverage is measured by catastrophic out-of-pocket payments, the percentage of population in the community or country. So it's about financing. It's about where do you finance the system, the healthcare system, where from and how do you finance the healthcare system. So it's a huge topic. I'm not going to tell you about it, but it's the financing. Actually, it's related to quality of the system or the utilization of the services. And these are not just directly shows the financial protection. So the topic is financial, but the outcomes are also related to healthcare services. So that was the first target, as you may remember. But yet the financing system of the population at the end affects the universal financial protection it provides, or there might be a lack of it. So over time, poverty is increasing and out-of-pocket payments are increasing as well. So this is the global proportion of the population with out-of-pocket health spending exceeding 10% or 25%. these are the thresholds that I mentioned. So it's called, if someone spends 10% of their household budget for healthcare, it can be calculated or accepted as a catastrophic healthcare spend. It depends on the situation, but you can see on the graph. So over time, so it's increasing. The percentages are increasing. More people are paying for their health more than before. And if you want to look based on the income of the countries, you can see the most affected countries are the poorest countries about catastrophic health expenditures and out-of-pocket health spendings. And this is an evaluation from COVID-19 time period from 2020. I want to show it because it shows that during pandemic, we know that there was problems to access. There were so many problems to access to healthcare, and when they conduct the survey, they showed that they saw and shared that for the upper middle income and lower middle income countries, the reasons with COVID-19 was the majority, almost the majority, or for lower income, it was the similar with low income, but one of the major problem was COVID-19 reasons. There was a related to COVID-19, but even during the pandemic, in low-income countries, people couldn't access healthcare because of their low income. It's not related to pandemic, right? So it shows us the inequalities. It underlines the inequalities between countries and regions. This is another perspective. There are some examples of countries with the composition of out-of-pocket health spending. So actually, my main message here is, it's not just out-of-pocket health spending. We should ask people, what are they paying for? So in some countries, people are paying for medicines, and they should be, if they're essential, they shouldn't pay for those, but maybe in some cases they're paying more. But in some cases, people are paying for dental care, and in some countries they don't. Maybe it's covered, maybe they don't have money to spend on dental care. We don't know. This is another question. But the main message is, okay, this indicator is looking the number or the percentage of catastrophic out-of-pocket payments. But we should also go in deep in this indicator, and we should, as public health researchers, we should ask people, what are they paying for? And it's also, and we can talk about more indicators showing that why people are paying for this. So these indicator is just one indicator. The percentage indicator is very broad indicator. So yeah, we should focus on these subtopics. So maybe you're familiar with this cube. This is the universal health coverage cube, and it covers the aim of the universal health coverage very well. So we talk about it is the universal health coverage is basically related to finance of the health system. So this blue cube shows the current pooled funds, and in the US, this cube, okay, these funds can be enlarged, but on which side we want to enlarge it, or what's the current situation of our coverage system, or universal health coverage situation in the country or the region. So it shows us the population who is covered, the services, which services are covered, and the costs of these services, covered services. These are the 3 dimensions of the universal health coverage. So the aim is to provide more and better quality services, to provide a greater proportion of the population in need, while also increasing the level of financial protection. Okay, so I mentioned about the umbrella, and this umbrella explains this very well. We want the umbrella to be big. Okay, we want the umbrella. The umbrella is universal health coverage. We want the universal health coverage to be big, to cover most of the population. We want the umbrella to be strong. We don't want another umbrella with holes, or a long-term umbrella, you know, this unqualified. We want the umbrella to be qualified to protect us in a quality way. And in this image, the storms, the rain, maybe the wind, these are the healthcare needs. Okay, or the diseases, situations, etc. So the umbrella, the universal health coverage, covers us from getting badly affected from these problems. If I have a small umbrella, and maybe one of my arms is outside of this umbrella, it doesn't. The system, the healthcare services related to umbrella doesn't cover my arm, and I will be affected. Or if the umbrella doesn't last long, I will be affected. Or if it will be broken in a wind or another health situation, the weather situation, I will be affected. So we want a strong, qualified, big umbrella, and we want it to cover most of the population. And we want the system, the universal health coverage, to last longer. Okay. So to remind those, there's a day. It's the 12th of December. It's called the Universal Health Coverage Day. And as a result, I will mention briefly about some points about these indicators. They cover so much, but they don't cover enough, you know. And we'll be talking about service access, service availability. There are some other barriers, and these indicators doesn't touch these topics. So there are some limitations, like lack of data, quality and continuity of this data. And because of these aggregates, it's a broader perspective of the indicators. We can underline, we cannot see, maybe mask and we cannot see some inequalities between the countries. But we know that vulnerable populations affect more than the others. Elderly people affects more than the others. People living with elderly parents or people, they affect negatively more than the others in terms of universal health coverage and healthcare services, and they are more vulnerable in terms of UHC too. So my humble suggestion is to work on local indicators and talk about the components of the UHC. We talk about the non-talked about the components of the UHC, and I don't care if you are a podcast person, I recommend you to listen these global health conversations, especially the ones related to universal health coverage and the system. They have really good examples. I really enjoyed listening to these podcasts when I'm preparing the presentation. And another suggestion, this is a brief suggestion. In Turkey, we have improved health informatics systems, as you know. And so some countries, these articles mention about it, some countries implemented these indicators in the country's monitoring and evaluating frameworks, And they said it's a good example and it worked well. And there are some different concepts to use to implement these indicators to our routinely collected data or some maybe administrative data. But this is also something that we should consider because of the strength of our country. And I mentioned about the numbers of universal service coverage index of Turkey, and I mentioned that there was an improvement throughout the health system reform, but for the last years it remains at the same points and scores. But at the beginning, actually before the universal health coverage was in the Sustainable Development Goals, Turkey was working on universal health coverage and equity, and it was this, you may remember this article published in Lancet as a good example of universal health coverage implementation in a nation, in a country with the health reform. And yes, so Turkey was and maybe is one of the given examples of universal health coverage globally, but for the last years, we have kind of forget about our strength on universal health coverage, and we start talking about it less. I believe we should publish it more, and we should implement our actions and policies on universal health coverage because we have the basics, we have the experience, we have the strength of this aspect. Okay, these are the local, my localized opinions. And this is the out-of-pocket expenditure percentage distribution all over the years in Turkey. And the most recent data shows that it's 4%. So this is the threshold is 10% here. So, but you can see that there is an increase for the last couple of years. We know that there is the impact of pandemic, but we should be maybe more analyze these increase. If you are interested in the topic, there are some tracking SC reports. It started to be published in 2015, and it covers all the indicators, how they are calculated, and it covers all the countries as well. And I mentioned about aging world a couple of times, but these keywords are not in the indicators, but we should talk about it more. These are not indicators, but these are the important keywords. The poverty and elderly people, they are more vulnerable considering poverty. They are more vulnerable considering inequalities, and the systems, the financial systems, should provide economic security for elderly people. And like I mentioned, they will be needing more, they will be seeking more healthcare, and people will be seeking more healthcare in their elderly age. So we should be focusing to make the system more accessible to elderly people. And while doing those, we should consider the financial gap. And we should be talking more, maybe more health expenditures from increasing the proportion of health in GDPs, gross domestic products of the countries. And we should be the advocates of the political determination for universal health coverage. I believe it's important to understand the keywords and the concepts with the perspective of an SDGs because it's credible. You know, this is the reason that I want to share this topic with you today, to understand the keywords, to have the ability to start discussions and maybe to improve the indicators and basically to share the knowledge. And I want to hear your thoughts and your experience on this topic as well. Thank you so much for listening.
Thank you, Dr. Sabanur Çavdar, for this informative and inspiring presentation. And now the floor is yours, dear audiences. If you want to ask something or if you have any contributions, please use the question and answer button, or you can raise your hand and I can switch on your mic. Please feel free to speak and also write your questions.
Oh, I have a question for you, Seval.
Really?
Yeah. As a public health professional working on elderly health, what do you think about the topic of universal health coverage while they are thinking about their questions?
Actually, the priorities will change in close further, actually, I guess, because the demographic change. Now, for example, we pay for infectious diseases, but in the next years, I guess, we will pay more for chronic diseases, and maybe the priorities will change. I can just say that. But maybe some of the audiences can tell something about it.
Thank you for answering my unexpected question. Yeah, you're right. We should be thinking about different aspects of the topic, and like you said, the proportions will be changing, and the problems will be changing, like you said. But it's important to be aware of that. And I know that it was a long presentation. Thank you for listening till the end, by the way.
You used the time properly, not problem. It was good. But
thank you.
I'm checking the question section. There's nothing. And there's no comment. So we have a couple of minutes. Maybe someone want to tell something about it, or we can close this session.
Yeah.
Okay.
Whatever you want. My mail, and feel free to reach out to me anytime.
So I guess no one wants to tell anything. Then I want to thank you all for joining us. And tomorrow we will have the last session with Dr. Ömer Ataç. And hope to see you tomorrow. Then thank you and have a nice day.
It's also, I'm sorry to interrupt, but it's also a really interesting topic. So yeah, I recommend people to join that one too.
Yes, the name of the session is Synergy for Health, Bridging the Public and Private Sector. And we are waiting for you for tomorrow's session. So we can end today's session, I guess. If you want to add something.
Thank you for joining us.
Thank you. Have a nice day.